The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio and 88.1 FM and WCWP.org. I am your host, Rebecca Miller, and my co-host today is, of course, Otto Lohse.
Good morning, Rebecca.
Good morning, Otto. And we'll be talking today with Barry Klitsberg, who is the Assistant Program Coordinator for Nassau County HIICAP program. We'll be talking about Medicare 2022 updates and open enrollment and all kinds of things related to Medicare. So why don't we just start the show and get right into it? I'm sure there's lots of questions with Medicare. So Barry, I think it's more important to start with kind of the open enrollment information, and then we'll definitely get into the 22 updates later on in the show. So, what are the deadlines? What are the things people should be doing right now?
Well, good morning. Just to edify people, HIICAP stands for Health Insurance Information, Counseling and Assistance Program, which is a free program, federally funded, to empower people on Medicare to get the information to make their best decision on how they receive their health care. Now, the first thing I tell people, and I do a lot of presentations at libraries and senior centers, is when you get mail from Medicare or Social Security, or if you have an existing plan, to read that. That's probably not marketing material, which you can read or not, because I'm starting to get tons of mail myself. But if you get a letter, like from your Medicare plan, your drug plan, or your Advantage plan, it's probably the notice of changes for next year. So you want to read that. That's the first thing. And if you get something from Medicare, like this book that I'm holding up, the Medicare and You 2022, you want to hold on to that. I don't expect everybody to read that cover to cover when they get it. I'm waiting for the movie to come out, and I want to see who plays me. But you want to take a look at this, and there's a good index so you can refer to it from time to time if you need to. And you might get mail from Social Security also explaining what the new premium will be next year, which we don't have yet. But those are the kinds of things that you really do need to look at. The other stuff you're going to get, the marketing material, the TV commercials, you can ignore that, you can look at that, you can read it. That's up to you. If you have a current plan and it works for you, and it's still going to be here next year, if you do nothing, you'll stay with that plan. All right.
So Barry, as we know, with the baby boomers, 10,000 people a day apparently turning 65, there could be a lot of new Medicare recipients listening today, or, the information is good. What are the things that you would recommend for them to kind of look out for? How do they start this process?
All right, well, that's a great question. Let's start at the beginning, okay? 3 months before you turn 65, you should apply for Medicare. If you're currently receiving Social Security checks, either because you're on disability or because you're retired and you started collecting before 65, you don't have to do anything. Your Medicare card will come in the mail automatically. But if you're 65 and you are waiting till your full retirement age, 66 in 2 months now, but you're not working and you're not covered by an employee group health plan, you do want to apply 3 months before. That's called the initial enrollment period, which is 3 months before your date of entitlement, the month of your entitlement, and 3 months after. So if you apply in that initial enrollment period, you'll get your coverage at the appropriate time based on your application date without a penalty for late enrollment. So you want to make sure that you apply prior to 65. And again, 10,000 people a day, you're right, it's an enormous number. Sometimes I think they're all calling me on the same day. you want to make sure you apply on time. That's the first thing. After you've applied and you get a Medicare card or a Medicare number from Social Security, then you can start looking at your other options. If you want a drug plan, or if you want a Medicare Advantage, which are HMOs or preferred provider organizations, okay, you can sign up for one of those and they will cover your drugs also. Or if you want a supplement with the drug plan, you could do that also. The reason I tell people to wait until they get their Medicare number, if at all possible, is because the first question you'll be asked by anybody when you sign up for one of these plans is, what is your Medicare number and the effective date? So you want to have that when you make that call. Okay, so those are critical things to remember when you're starting to apply.
Yeah, I
Once
think
you're
some-
on, I'm sorry?
I'm sorry. No, I think some people think Medicare, okay, I'm on Medicare, that's where it ends. You know,
No. Medicare
Right.
does have gaps. There are coverage gaps. There's cost sharing. In other words, Medicare, like Part B, your medical insurance, after you meet a deductible, which is now $203 for the year, then Medicare pays 80%, which is good coverage, but it's not comprehensive. So you may want a supplement to cover all or part of that 20%. Medicare doesn't cover drugs, neither do the Medicare supplements, the Medicaps. So you would want a prescription drug plan. Now, this year there are 28. Next year, they're going down to 19. And we just saw this the other day when we got the Medicare and U book. So there are still plenty of plans, plenty of options. You can call us or go online to medicare.gov and look at all the plans and see which one covers your drugs the best.
Right.
You can sign up. And there are Medicare Medigap plans from A through N. H, I, and J are no longer sold because those were the original plans that had some drug coverage, but it wasn't the equivalent of Medicare prescription coverage, so they don't sell it anymore. If you have it, you can keep it, but I don't recommend it.
Barry, I think you're so right. I think there is definitely people out there, especially people 65 or turning 65 or 66, whatever,
Mhm.
that just make assumptions about Medicare that, okay, I'll have my insurance for the rest of my life. And, that's what it is. So it's kind of an awakening, I think, for many people who don't really, don't read up on it, or maybe their parents they're not familiar with it. The basic, I want to say the basic, but Medicare, what does it cover without having any other additional supplements?
Okay, there are two parts to Medicare. There's the Medicare Part A, which is hospital insurance. That covers you for an inpatient stay, either in a hospital or a skilled nursing facility. And in English, that means a rehab hospital. Let's say you're in the hospital for 3 or more days and you're admitted. You have to make sure you're admitted, not there for observation. If you have admitted status for 3 days or more and you still require care, but it may not be at the level of acute care in a hospital, you would need skilled nursing care, physical, speech, or occupational therapy on a daily basis. Medicare will cover that. That's all covered under Part A. Home health care, if you've been hospitalized, is also covered by Medicare Part A. So
Now, is that at 80% or is that?
No. That's full coverage after you meet a deductible for the hospital. The hospital deductible this year is $1,484. After that, Medicare pays the rest in full for the first 60 days of a hospitalization. Right. If you have to stay longer, there may be daily copays, which your Medigap plan could cover.
Mhm.
There's also the skilled nursing care, the skilled facility. You have to be in a hospital for 3 days and then go to that skilled facility within 30 days for the condition that was treated in the hospital. And you must require daily care. So those are the two major portions of Medicare hospital insurance. Medicare medical insurance is your outpatient, if you go to a doctor in his office, or even if a doctor comes to the hospital to treat you, like a surgeon or an anesthesiologist, who's not paid by the hospital. But if he's bills independently, your medical insurance covers 80% of that. In office, out of office, durable medical equipment, lab tests, outpatient therapy, outpatient procedures. Those are all covered by Part B, 80% of the approved charge. You're responsible, like I said earlier, I believe, $203 for your annual deductible for Part B, and then Medicare pays 80%. And again, a Medigap plan can cover all or part of that 20%, depending on the plan.
So if you don't have another plan, you wind up in the hospital for $100,000 bill, round numbers, you could wind up having to pay $20,000.
No, that would be highly unlikely.
Okay.
Because again, Medicare pays, after you pay your hospital deductible of $1,484, for the first 60 days, you're covered in full.
Oh, okay.
Yeah. All right. Then if you there from there 61 to 90, you have a daily copayment of 1/4 of the deductible. It works every year. So it's $1,484. So that would be $742, $385 approximately would be your daily copay from day 61 to 90. And then if you're in the hospital more than 90 days, you have a lifetime reserve of 60 days where you pay $700+ a day for that, $741 for that. That's why a supplement plan is very important if you have a long hospitalization. Also in a skilled nursing facility, the first 20 days are covered in full, no copay, but from day 21 to 100, you've got a daily copay of about $175 a day. So you do want some kind of supplemental coverage for these gaps.
So your options for supplemental coverage, is it Medigap or
Right.
Medicare Advantage? One or the
Medicare,
other.
you can't have both.
Right.
Now, Medigaps don't cover drugs, so you would also need a drug plan. Medicare Advantages generally, but not always, cover prescriptions. They also cover vision, dental, hearing at different levels. But unlike Medigap, which is standard, so let's say you take Medigap Plan N, no matter who sells Plan N, the benefits by law are identical. So you're looking at price and service, but the benefits are the same. With Medicare Advantage, they're not standard. The formularies are all different. Their benefits could be different, and their costs, the premiums and your copays could be different from plan to plan. Even some plans, some companies offer 2 or 3 plans. Even within the same company, the benefits could be different. So we really have to do a little more research. If you're in a Medicare Advantage plan or you're thinking about it, we kind of need to get into the weeds to see, well, what are the benefits and what are the costs?
Now,
And
Barry, I'm sorry.
With an HMO, you got to use the doctors and providers in the network.
That's an advantage plan.
That's right. And with Medigap, you don't need a referral and there's no network. Any doctor that takes Medicare, Medigap will pay. Medicare Advantage, you work with a network. And with an HMO, you usually need a referral to see a specialist. With a preferred provider organization, PPO, you don't need a referral. And if you go out of network, you still have coverage, but you have a higher copay.
Just like Plan N, for example, all right? I'm on Plan N, and the numbers that existed now, Empire was 192, United Healthcare 211, and Humana 284. And what I'm hearing you say is for 192 or 284, you're going to get the same deal because Plan N is Plan N, no matter who you get it from.
Absolutely correct.
So the premium, it's a combination of the premium and what the value or the quality of the company is you're getting insured by.
You're absolutely right. That's why I tell people, I mean, if you had a problem with the service from one company, that's something to consider. Most people consider cost. That's primary because the service is generally pretty much the same. When the doctor submits a claim to Medicare, let's say you have a Medigap plan, on the bill that they submit to Medicare, and it's usually electronic. And you know this, when you go to a doctor, the first question that the staff asks, what insurance do you have? But you tell them you have Medicare and you have a supplement, using your example, Empire. They take that information and they put on their bill, the claim form to Medicare. This is the Medicare number. your date of birth, your name, etc. And then it'll ask what other insurance, what's your supplemental insurance or secondary. And they will then put your Empire or AARP group number and your ID number. Medicare automatically crosses that over from Medicare to your Medigap. So you don't have paperwork. And it's all done within the same time period. And then I've seen people call and say, how come I got a notice from my Medigap and I haven't gotten the Medicare notice yet? Because Medicare's cycle of submission is different than the Medigap. Medicare has to pay within 2 weeks for a clean claim electronically. If it's a paper claim, it's going to be 28 days. But they may not pay or send the Medicare notice for another few weeks or a month. The Medigap can send it out as soon as they process it.
You know, it like comparing Medigap plans, G versus N or whatever, or within N, one company versus another, is made relatively easy because of things like in the magazine, the book you had, and
Right.
websites that give you the ability to compare. But even within that, it's a little tricky, I think. You know, what goes on between the alpha plans, like between G and N, doesn't come right out and hit you, in
Well,
my opinion.
if you call our office, and I'll give you the number, it's 516-485-3754. We could send you the most current list of the Medigap plans on Long Island. On one side are the benefits, like you have in your book. On the other side of that paper are the companies that sell those plans and what they charge. So it kind of simplifies matters. So you see, well, these are the benefits that I want. Turn it over, and who sells that plan? Because not all companies sell all plans, but who sells the plan and how much do they charge? And a nice thing, one good thing about Medigap, besides not having a network, in New York State, it's called continuous open enrollment. If you have a Medigap plan now and you decide, let's say you have N and you want to go to G because you realize you're going to start going to more and more doctors, well, you could switch from one plan to another anytime. It's continuous open enrollment. It's effective the first day of the following month.
So basically, then I frankly didn't get that through my head either. So if I want to change Medigap plans from, let's say, from G to N or N to G, I could do that anytime. I don't have to do it during the rush period, if you will,
No,
which is the 15th of October to December the 7th, when everybody is going nuts because they have to, all the paperwork and all this stuff that goes on. But that
Right.
only applies to Advantage plans.
Advantage plans and prescription drug plans.
Oh, okay.
The
Okay.
prescription drug plans have the same time period. October 15th through December 7th, you could change anything. But again, in New York, you can change Medigap anytime.
Okay.
And one other
Well,
thing
we
I want
actually have to take a quick break. We will
Sure.
be right back with our guest, Barry Klitsberg, and we've been speaking also with Otto Lohse, our co-host. We'll be right back. You've been listening to Project Independence in You on 88.1 FM and WCWP.org.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm your host, Rebecca Miller, and co-host Otto Lohse. Today, our guest is Barry Klitsberg, and we've been talking about all things Medicare, from A to Z, whatever we can get in there. It's really great information, so let's get right back to it because we still have a lot of questions. I know over break, you had mentioned you wanted to bring something up with Otto, but if I may just also talk about people that do have, will be able to carry over their health insurance into retirement. how does that work in terms of coverage?
Okay, once you retire, and if you are lucky enough to have a union plan or an employer retirement health benefit, first thing to do is remember to keep that, because those plans cover things Medicare doesn't, like drugs and vision and dental and hearing. And if you drop that, you probably can't get it back. So you want to keep that. But also, Medicare is your primary insurance once you retire after 65. So those plans work as your supplement. So a lot of times people say, well, I have a supplement. Medigap is a supplement, which is true. Not all supplements are Medigap. Union and retiree plans are also supplements. So Medigaps have a defined set of benefits. Retirement plans do not. It's whatever the employer negotiates with the insurance company. But usually they cover additional services. So a lot of what we're talking about, like the Medicare, Medigaps, or the Advantage plans, may not be appropriate for people that have a retirement benefit. Like if you're a federal retiree, you want to keep that as your supplement. You can keep that as primary, but I don't recommend it. Other people don't have the option. If you're a state employee that retires, you go into their system. It's called NISHIP, New York State Health Insurance Program. That's the supplement to Medicare. New York City retirees have their retirement benefits, and that's being changed now also, with a lot of city employees having to go to a Medicare Advantage plan. We're getting a lot of calls about that. And it's not a bad plan, but it's different. So people have a lot of questions. So all these retirement plans are different. Most of them are very good, but they do supplement Medicare to one degree or another, depending on the plan they negotiate with the union or with their employees or with the insurance company.
What about things like dental, vision, hearing? I know that a lot of that is not covered, even in kind of the insurance you carry over. How do we go about getting that type of coverage?
Right. As we know, Medicare doesn't cover most routine vision, dental, and hearing. Right? They don't cover hearing aids or fitting for hearing aids. They don't cover checking your prescription on your glasses. Right? And almost all dental work is not covered. If there's a disease of the eye or an illness, then Medicare will cover that, the diagnosis and the treatment. But we need to see if you want to have additional coverage for those services. There's one of two ways to do it. Buy a separate policy. There are a lot of companies that offer dental coverage or vision coverage. You can buy a separate policy, which is not a Medicare-related product, or a Medicare Advantage. The HMOs, or the preferred provider organizations, most of them do offer some vision, dental, hearing. But because they're not standard like Medigap, we would have to go into the details of each plan to see what vision or dental coverage they offer. So we would have to really check into that more closely.
Now, Barry, you sent stuff out prior to the show, and one of the numbers that stuck in my head was that 42% of the people who need to have additional insurance now have Advantage plans, and that the Advantage plans are on the rise. So personally, I kind of, because I work for the Mars, the candy company, we have some supplemental insurance money, which we use to go on the open market. So I try to compare on this agent that handles Mars Advantage plans, and found out that it was just about impossible in my judgment. And there's a lot of Advantage plans, and it's not like comparing Plan G to N.
Right.
It's like I said to myself, you almost need a lawyer to figure out from one Advantage plan to the other Advantage plan.
You have to go into the details. Now, let's say you go onto the Medicare.gov website and you enter your prescription drugs and you tell it, because you can filter, you want a preferred provider organization, because you can get down to that level of detail. It will tell you the various benefits. based on your drug cost first, because we know that. We don't know how often you might go to the doctor or these other things, but based on the information you put in, they can tell you which of the Medicare Advantage plans covers your prescriptions best. And then if you click on plan details for that plan, it will then give you all of the details. Does it cover vision? How much? Does it cover dental? Again, what does it cover? Does it cover just routine dental care? Does it cover other things like maybe root canal or caps or anything like that? But we need to go into the details. And you're right, it's not that complicated when you've been doing it for 47 years like me. But
Yeah.
but for most people who are not fluent in Medicare, it's intimidating. And I've walked people through this. And I say, all right, click on this button, and they're on their computer, and I'm on my office computer, and I tell them what to click on. And I say, now you scroll down, and you can see the various vision, hearing, dental benefits, the hospital benefits, the doctor, the medical benefits. So you can get all that, but you have to know where to click and what to look for. And that's why people call our office, because we can help walk them through that. Or in some cases, we'll print out a summary of the plan and send it to them so they can then make an informed choice. Now, I don't endorse a company or a product. I just give information.
I like right now, I just got this in the mail yesterday, which is timely for today. It's get the facts about Medicare, and it's in the upper left corner. It says follow my health, which is, I think, like my chart. It's another version of a patient portal. And then it says e-health. And then on the back, there's a few questions. And it says, speak to a licensed agent. All right. It looks like it's coming from Medicare almost. And then the thing that gets me is it says all in one, available in your area. Dental coverage, vision coverage, hospital indemnity, 0 monthly premium, no copays, no deductibles. So basically, I don't have to pay anything for anything. And this is going to take care of everything, is my perception when I read this thing. And I believe a lot of people get flooded with this type of thing now.
That's marketing material. That's marketing. Medicare will never send you a letter asking you questions about your health.
Right. But my point is that when people get these kinds of things, they maybe not intentionally, but they can be misleading into thinking you're going to get everything on the planet and pay nothing.
It's not true.
Yeah, I mean, it just seems too good to be true. And
first, we got to remember that the Medicare Advantage plans are county specific. So what's available in Queens or New York City is different than what's available in Nassau County or Suffolk County. Each plan is different by county. One of the rules is you have to live in the service area, which here means you have to live in the county where the plan is. If you go now, I don't know if you've ever seen the fine print on those commercials on TV where they talk
probably haven't looked at it, but
well, because I paused my screen once. Yeah. And it's based on your zip code. Well, it's really, county specific. Like they talk about the buyback program where you get your Medicare premium paid back. That's not available on Long Island. But these are commercials for the metro area.
Yeah, but I don't know either. Like if my doctors fall within a network, you really have to dig into that to make sure they do, right?
What I tell people is when I give them when I do counseling with individuals, and I'll pull out the various plans. And if it's an Advantage plan, the first thing I say is your homework is to talk to your doctor's billing office because they know best what plans the doctor is in.
And then if you wind up having to go to a specialist or somebody,
that's something else. But
you really want to go to, but you can't because they're not in the network. That's one of the negatives, as I said.
That's one of the advantages of a preferred provider organization. You can go out of the network, you have a higher copay, but you still have some coverage.
See, that's the thing I didn't get through my head until I read the book somewhat, the Medicare book, that there were different categories within Advantage plans, like you pointed out, PPO and HMO, and there were a couple other initials that I didn't bother going into.
Those are the only two on Long Island. If you live on a farm, you've got the EIEIO plan, but that doesn't apply.
EIO.
Right. No, but
Sounds like old McDonald.
the two plans on Long Island, the two types are the Medicare Advantage, which are HMOs or PPOs. Some of the other plans are not available out here.
Okay. And
Barry-
I'm sorry, but within that, is there a benefit to PPO or HMO? What should I?
The benefit is if you want to get your drug coverage through them, the premiums are also lower normally than the Medicaps.
Right.
So a lot of times people say, I don't want to pay a premium for this. Then I said, then your only option is a Medicare Advantage.
Okay.
And then you look at the co-pays and see which one works best.
Okay.
Barry and Otto, both. These are just things to ponder. We're talking a lot about younger seniors and coming on, but also a lot of basics about Medicare. And I'm hearing the word click. You click on here, you click on there. And that's convenient for younger seniors and seniors that, are becoming a lot more tech savvy, especially during COVID. We've had with Project Independence, we've had a lot of growth there with our seniors becoming more tech savvy. But, then we have people that don't have smartphones and don't have computers, never will, don't want any part of it. How do we serve them? And, I know I've heard so much about long wait times with Medicare on the phone. Is that still a viable option, calling in for people who don't have access?
It is certainly a viable option. Especially if people want to do this over the weekend when we're not in the office, because Medicare is open 24/7. But if people don't have a computer, they're not tech savvy, they can call our office and we will send them material about each plan, HMOs, PPOs, the drug plan summaries. And we'll also send them something to fill out. Put your drugs down. Give us your date of birth, your drugs, your name and address, and your pharmacy. We will run their drug list for them. And if they say they want a drug plan, we will just print out the drug plan, the top 3 drug plans. If they want Medicare Advantage, we'll give them a summary of the top 3 Medicare Advantage plans. And then they can call. We can then go into the weeds with them on the phone. So we can do this on the phone. In some cases, we do this in person. We're not doing that much because of COVID.
Right.
And people do need an appointment to come in. So if they call our office at 485-3754, 516 area code, they could ask for an appointment, and depending on the availability of a counselor, we'll try to help them with that.
So that process, when you're doing this online and you're able to, it's immediate. So when people are filling out the form or going over with you or just sending in the applications or whatever it is, how soon do they have to get that in? What's the process with that versus a computer?
The earlier, the better.
Right.
Now, I try not to sign people up myself online if they're calling me on the phone, because I want them to see what I'm looking at. But there are times where people will call at the end of the enrollment period in a panic and say, just sign me up for something. Well, I said, these are the plans that would work best for you. Can you sign me up for something? So I have to make sure they understand what they're getting into, because they could be locked in for a year.
Right.
So I try to do it either through the mail or in person, or have them call the plan after I send them the material. Or if sometimes they'll call back, said, this is the plan I want. Can you sign me up? So I can. I can't do Medigap. I can only do drug plans and Medicare Advantage. Because of New York State insurance law, you've got to deal with an agent of the company. So we send them that information, the numbers to call, and they will switch them over. But I can't do Medigap, but I can do drugs or Advantage.
I think one of the things that, like I know myself, you enter information about as is right now. This is the medication I'm taking right now. This is my health state right now, which can change tomorrow. And an interesting thing, a friend of mine wound up, the doctor switched them to some medication called Grayley's, and all of a sudden, a 90-day supply was $600 within their drug plan. And it was very effective stuff, but it was also very expensive. And it's hard to cover all your bases. You don't know what you're going to get into.
Now, there is a program in New York State called EPIC,
That's why I
Elderly
want to ask you
Pharmaceutical
about.
Insurance Coverage, for individuals with income under $75,000 or couples with income under $100,000. They could be eligible. EPIC will generally lower their drug costs. If your income is under $20,000, you get coverage immediately at a very low premium. In some cases, zero premium.
Now,
If you're over 20, you go into the deductible plan, which is a sliding scale based on income. But once you hit your EPIC deductible, you don't pay more than $20 a prescription. So that's a really good source of additional coverage for drugs. And there's another program called Extra Help, which is for low-income people whose income is under $1,469. What this program does will pay your Medicare Part B premium, that $148.50, they will pay that. And in addition, you will get extra help, which for brand name drugs, it's usually, in most cases, $3 and change for prescription. So that's another great source of help for, again, this is for low income folks.
Barry, back to that EPIC plan, the 100,000. Do you know what that's based on? I mean, if people have income coming in from IRAs or whatever, is that part of it?
It could be. There are different, and I'm not a tax person.
Right.
But there are different types of distributions that do count and some that don't. But they don't care about your assets, only the income. And it's from the previous year's tax return. So there are some people who retire January 1st. They're still going to have to go back to the previous year because that's the information that's available.
All right, you know what? Let's come back to that. We have to take a quick break. We will continue with Barry Klitsberg with all things Medicare. You're listening to Project Independence in You on 88.1 FM and WCWP.org, and we will be right back.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, the host for today, along with Otto Lohse, our co-host. We're speaking with Barry Klitsberg, and we are talking about all things Medicare. I know, Otto, over the break, we started to talk a little bit about other options for medicine.
Yeah, well, I've used the plan. It's not even a plan. It's GoodRx. I have no idea how this pricing works, but I go on GoodRx's website, put in the medication that we're going to get, and it tells me a price. And we save $200 round number, on one medication because it said, print this coupon, bring it to Walgreens, and here's the insurance. Here's what it costs: $80 versus $280 with my insurance. My drug coverage. And I just wanted to ask Barry, it seems like there's a lot of those kinds of plans around, like GoodRx, and Empire sent me a card. And what's your thoughts there?
Those plans can work. They don't work with Medicare. So if you have a Medicare drug plan, if Medicare pays, these plans won't. But they're not really insurance plans. They're discount programs. And sometimes people will call me and say, I never signed up for a Medicare drug plan because I was using this discount program. I want to sign up for a drug plan now. Well, they would have a penalty for enrolling late. So what I tell people a lot is that when you are eligible for Medicare, even if you're not taking drugs or if you have other sources that are not insurance, sign up for one of the less expensive plans so you have coverage to avoid that penalty later on. Plus, there may be other drugs that the plans can help with that your discount program doesn't. So you will want to avoid that late enrollment penalty. And you also want to get into the program to have coverage. If you're using GoodRx or any other number of these discount programs, you go to the pharmacy, you give them that card, tell them not to bill your Medicare drug plan for this.
Right, but you don't have to do that.
Good RX won't pay if Medicare is.
You don't have to do that for everything. You can do it for a specific drug where you do gain an advantage with a
Right.
discount.
The only thing is if the drug plan itself is not billed and you have a deductible, that doesn't get credited towards your deductible. So
Right.
there are a lot of things, again, we need to go into the details on all of this because that's where the devil is. The devil is in these details. And I'm not saying you shouldn't use those if they work.
Well, once you've covered your deductible, then it's gravy train.
Well, again, every case is different.
Right.
Mhm.
So we would have to find out, which one works better for you. But you certainly want to sign up for at least a basic plan. And the least expensive plan next year is $7.20 a month. So if you sign up for that, you can switch every year.
Right.
But at least you have coverage. And one other thing, I was talking about Epic before. One other thing about Epic that is really good, if you are in a program like Epic, and this goes national, a state assistance program, it's called SPAP, State Prescription Assistance Program. If you're enrolled in one of these, you can make a once-a-year switch from your drug plan to another drug plan outside of the enrollment periods. So it's like having a get-out-of-jail-free card, because if you're in a drug plan and your drugs change and the plan doesn't cover some of this new drug, if we can check and tell you if any of the other plans cover it, if you have Epic, you can switch once a year. So that's a nice little thing to have in your back pocket.
Well, let me tell you
I'm sorry. You know what this tells me is that the service you provide, HIICAP provides, is invaluable
yes.
for people to take advantage of. Because, like you said, the devil is in the details. I use that often, and you guys are in the details. You're the devil in the details, and and there's a lot of things that if you pay attention to it, you can save yourself a lot of money and get good coverage.
Absolutely.
I mean, I'm semi-knowledgeable because of being with you a half a dozen times, all right, and being prepared to talk to you. I've learned a lot, and the more I learn, the more I know I don't learn. I don't know, so reach out, get help. Is my point. I think you have to define what your goals are. What do you want to be covered for? Do you want to be able to go to any doctor you want? What do you need? And talk to somebody like you and your group about what the deal is.
Otto, that's so true. I mean, someone like me who I'm 10 years away from it, it's nerve-wracking to hear all these levels of a process. And Otto, even someone like you who's been in the system for a while, still learning and getting more information. But we don't have a lot more time. And I really just want to tap on the deadlines that people need to be aware of, when to get things in, if you're doing this online versus if you're not. And then also, if you could provide some of the updates for our seniors to be aware of, that would be great.
Yeah, certainly. And people can call our office at 516-485-3754. We're currently distilling all the information for next year because it just came live today. So we're going to have updated information. But I do want to talk about one other thing, and that's Medicare updates for COVID. The testing is covered in full, no deductible, no copay, and the vaccine is covered in full, no deductible, no copay. And if you're going for a booster, like I am this afternoon, that's also covered in full, no deductible, no copay. So we want to make sure that people know that these preventive services, just like the flu shot, is covered in full, mammographies, other preventive health screening tests are covered in full, no deductible, no copay. And if you look in the book, ta-da, another plug, it has a whole section on the preventive benefits and what is the coverage. There you go. Otto has it also. Yeah.
I tore a page out, actually.
Oh, no, I never do that. When they make a movie, I think, Robert Redford is going to play me.
So what are the deadlines that people need to be aware of?
Okay. The first deadline is December 7th. You can change your plan October 15th through December 7th. The change is effective January 1st. The information is live now, but you can't sign up for a new plan for next year until October 15th. And there's one other enrollment period I want to talk about. This is the Medicare Advantage open enrollment. If you're in a Medicare Advantage plan and you want to switch from one Advantage plan to another, if you want to drop it completely and go back to traditional Medicare, there's a second enrollment period from January 1st to March 31st, where you can switch your plan. You can switch once during that Advantage open enrollment period, and it'll be effective at the beginning of the next month. So if you sign up for an Advantage plan, and then your doctor tells you as of next year, well, I'm leaving that network. I'm only going to be in this other plan. You can switch, or you could drop it completely and go back to traditional Medicare during that Medicare Advantage open enrollment period. And that's January through the end of March.
Barry, when you talk about switching, my experience is all I can go on. Even switching from plan G to N, or even within G, switching to another carrier. My wife and I end up on the phone for about 2 hours at the least, and with everybody reading all the legal stuff to me that they have to go through. So is that pretty much the standard? I mean,
it takes a while. I can't say 2 hours, but I've done this with clients in the office, and it's taken close to an hour. And this is when I've had all the information sitting in front of me.
Right. Okay. That's what I'm cautioning people is
so
be prepared to spend some time.
When you call somebody for this, and a lot of times I get this every day, I'll say, all right, let me have your Medicare number. Hold on, I got to go get it. Or let me have your drugs. Hold on, I got to go get it. Or let me give you a phone number to call. Well, let me go get a piece of paper. When you call us, save yourself some time by preparing in advance based on what you think you might need, but certainly a paper and pencil.
And questions.
Well, the questions are always good to write out in advance. I do that when I go to the doctor, just to make sure that if he's in a rush or I'm in a rush to get out, that I get everything answered. So it's always good to write your notes down.
You know, doctors, that's a different topic because you get 15 minutes. So you better take advantage of your 15 minutes.
I have a great internist. He spends as much time with me as I need, but some of the other doctors, you're absolutely right. They're in and out.
Yeah, they're on the clock.
Right.
What are the, like, I want to say the top 5 updates that are happening in 22 that people definitely need to be aware of?
All right. Well, there have been some other updates, like acupuncture can be covered now, which was never covered before. But for chronic lower back pain, you can get 12 visits from a certified practitioner and an additional 8 if it's necessary. That's something that's very new. The other things, the COVID, I mean, we're still in the pandemic situation where the county is keeping people's Medicaid open without recertification or having to reapply because of the pandemic. I will tell you that because of the pandemic, everybody's working from home at least part-time. So sometimes if you call an office, like at social services for Medicaid or my office, you may not get a person, but you will get a return call. Right. The other things, like I said earlier, read your mail. We went from 28 drug plans to 19. Premiums change. The deductible is changing. It was $445. The maximum deductible that's now allowed is $485. When we send you a summary of your drug costs, it will include your premium and what you pay out of pocket for the balance of the year. So if somebody turns 65 October 1st and they want to plan for October, they will get for this year 3 months worth of cost. And next year, it'll be 12 months. So we have to...
Go ahead, I'm sorry.
Yeah, so again, we have to fine tune everything, but those costs, the deductibles, premiums, copays are all built into the number we send. And
would you get like a drug plan under Medigap and Advantage? Are they going to be kind of the same?
No. First of all, Medigap doesn't cover drugs. You would need a separate.
Oh, right. Yeah.
But
What I meant was you need to have a drug plan. If you have Medigap, is that drug plan under the Medigap umbrella, if you will,
Okay.
in the same world as the drug plan under an Advantage plan?
The benefits will probably be different. It's the same world because they're all government contractors, so they have to submit their plan for the following year every summer. So there are certain rules they have to follow. They have to cover at least one drug in all of the 7 major categories. All right. Usually, also a good thing to note is if you're taking inexpensive generic drugs, many of the plans will waive your deductible. They'll just start covering you from day one. Sometimes people will call and say, well, this plan has a $445 deductible, but it's telling me that my drug cost is going to be $250. That means they're not charging you the deductible because you're probably taking generic drugs that are less expensive. And this is very common. Mm-hmm. So again, these are the details that people, again, they just look at what we send them. So, well, how come this has a deductible, but my cost is less? Because there's no deductible for those drugs. All right. All my drugs are that I take are generic, and they cost just a few dollars.
If there is generic, sometimes you wind up.
Well,
with,
they got to wait for the patent to expire, and then these other companies then start making generics. If it's brand name, they'll cover them, but they will be more expensive.
Right.
And when you go on the website, if you put in the name of a drug and there's a generic equivalent, it will pop up a screen that says there's a generic equivalent, and this is what it's called. Do you want to go to that? Or do you want to stay with the brand name? If you stay with the brand name, just so you know, it will cost a lot more.
That would be under Medicare.gov if you did
right.
that.
When you do the plan finder, it'll tell you that. And again, I don't tell people what drug to take or brand name or generic. There may be medical reasons to go one way or another. I'm not a physician, so I can't tell you that. I can only tell you this is what's out there.
Is it Medicare.gov or MyMedicare.gov?
You could do both. If you set up your own individual account, that's MyMedicare.gov. But if you just want to do this one time, and you enter your drugs, it won't save it. On MyMedicare.gov, it will be saved. It'll ask you for your Medicare number. So there's a tie-in, and you'll have a user ID and a password for security. But then you enter your drugs and your drugstore, and it will save it from year to year.
Okay.
So you go in, you can add a drug or delete a drug, or just keep it the same. If you want to change your pharmacy, that's fine. But if you don't change anything, it will say, all right, this is what we have on file for you. Is it the same? If it is, then you just go to the next screen.
Okay, that's good to know too.
When I do it, I usually don't set up an account because I don't want to have people's information. So I just do a general search and I see these are your drugs. This is your drugstore. These are the plans that will work best for you. And once I leave that screen, everything is erased. MyMedicare.gov, it's saved.
Do you save your own?
Do I save my own?
Yeah.
I am not great on the computer. And I only take a couple of drugs, and I knock it out in 2 minutes.
Okay.
And remember, I've been doing this from day one.
It's second nature to you.
Yeah, so that's why when people send me the form back, I can get them a printout that day.
Right.
Mm-hmm.
Okay.
I wonder if HIICAP or other agencies have almost like a timeline for people. Like here we're in, July, this is when you should be doing this, start doing that. Like it's so, like with Project Independence, we are all about planning. If you just got to plan, you got to plan for I'm going to say the worst, but plan for things to happen, the hiccups, the things that are going to take longer, like a 2-hour phone session. If you're not planning for that and you can't be on the phone, that means another call back. So is there anywhere that, someone who may be even new or, people that kind of wait to the last minute can have a timeline to look at?
Well, when I do outreach, I tell people that starting late September, you're going to start getting your updates. You're going to start getting mail from Medicare. That's what you need to read. Assuming you're already on Medicare. So I tell people, you don't have to do anything over the summer. Starting in September is when you really need to start putting your stuff together, and late in the month, start reading your mail. I prepare internally well in advance, and I do outreach all year long. I mean, I did a program here, I think it was in April or May. Again, these are the dates, but we're not there yet. So again, I tell people when I'm doing my outreach, this is what you need to look for. If there are changes in the program, like when acupuncture went into effect, I said, this is what we need to know for now.
Barry, I mean, this could go on for hours. You have provided such essential. Thank you so much.